EnglishVibesHub, everyone. I'm your host, Emma, and I'm excited to be here today with Liam to talk about something really important for all of us: mastering medical idioms. You know, those phrases that doctors and nurses use that can sometimes leave us feeling confused or lost. Liam, have you ever been in a situation where you didn't quite understand what a medical professional was saying?
Absolutely, Emma. I think we've all been there at some point. It can be really intimidating, especially when you're already stressed about your health. But today, we're going to break down some of these medical idioms and phrasal verbs so you can feel more confident and in control when discussing your health. Let's start with to be on the mend. What does that mean to you, Emma?
That's a great one to start with, Liam. To be on the mend means you're recovering from an illness or injury. For example, if someone has been sick for a while but is finally starting to feel better, you could say, "It's great to see you're on the mend." It's a very positive and uplifting phrase, isn't it?
It is, and it's something you might hear from a doctor or a friend who's checking in on you. Another phrase that's quite common is to take it easy. This doesn't just mean to relax. In a medical context, it means to avoid exerting yourself, especially when you're recovering. Emma, can you think of a time when someone might advise you to take it easy?
Yes, definitely. If you've just had surgery or a bad injury, your doctor might tell you to take it easy for a while. This means you should avoid heavy lifting, strenuous exercise, or anything that might put a strain on your body while it's healing. It's all about allowing your body the time and rest it needs to recover properly.
Exactly, and related to that is the phrase to be in good hands. This is something you might hear when you're about to undergo a medical procedure, and it's meant to reassure you that you're being taken care of by competent professionals. Emma, how do you think this phrase can affect someone who's nervous about an upcoming procedure?
I think it can make a huge difference, Liam. Knowing that you're in good hands can really calm your nerves and make you feel more secure. It's not just about the technical skill of the medical team. It's also about the care and attention they provide. When you feel seen and heard by your healthcare providers, it can significantly reduce your stress levels.
That's so true, and speaking of being seen and heard, let's talk about to get a second opinion. This is when you decide to consult another doctor or medical professional to get their view on your condition or treatment plan. Emma, why do you think someone might want to get a second opinion?
There are several reasons, Liam. Sometimes, you might not feel entirely confident in your current doctor's diagnosis or treatment plan. Or maybe you've been diagnosed with something serious, and you want to make sure you're exploring all your options. Getting a second opinion can provide you with more information, reassurance, or even an alternative approach to your care.
It's all about being proactive and taking charge of your health, isn't it? And that's exactly what we're aiming for with this series on medical idioms. We want to empower you with the language and confidence to navigate any medical situation that comes your way. Emma, what's the next idiom you'd like to explore?
Well, Liam, I think it would be really helpful to look at to be under observation. This phrase is often used in hospitals when a patient needs to be monitored closely, usually because their condition is unstable or could change quickly. Can you think of a scenario where being under observation would be necessary?
Yes, for example, if someone comes into the emergency room with symptoms of a heart attack, they would likely be put under observation for a while. This means the medical team will keep a close eye on them, running tests and monitoring their condition closely to make sure they're receiving the right treatment and to watch for any changes that might require immediate action.
Exactly. And it's not just limited to emergency situations. Sometimes, even after surgery, patients are kept under observation to ensure that they are recovering as expected and not showing any signs of complications. It's all about providing the best possible care and minimizing risks.
Minimizing risks is a big part of healthcare, and understanding the language used in medical contexts can really help you feel more in control of your health journey. Emma, as we continue to explore more medical idioms, what do you hope our listeners will take away from this episode?
I hope they'll feel more confident and less intimidated by medical jargon. Being able to understand and use these idioms can make a huge difference in how you communicate with healthcare professionals and how you advocate for yourself or your loved ones. It's all about empowerment through knowledge and language.
That's a great point, Emma, and we're just getting started. In our next segment, we'll dive deeper into more complex medical idioms and phrasal verbs, providing you with even more tools to navigate the healthcare system with ease. Stay tuned, everyone, as we continue to explore the fascinating world of medical English.
So, Liam, let's dive right back into the world of medical English. You mentioned earlier that understanding complex medical idioms and phrasal verbs can really help patients navigate the healthcare system. Can you give us an example of how this worked for you or someone you know?
Actually, Emma, I have a great story about my grandmother. She was diagnosed with a condition that required her to rule out certain foods from her diet. At first, she was really confused about what that meant, but after we explained it to her, she was able to get to the bottom of her symptoms and work with her doctor to find a treatment plan.
That's a great example, Liam. Ruling out something means to eliminate it as a possibility, and getting to the bottom of something means to find the cause or solution. These are really useful phrases for patients to understand, especially when they're trying to piece together all the information their doctors are giving them.
Exactly, and it's not just about understanding the phrases themselves, but also about being able to use them in context. For instance, if a doctor says, "We need to run some tests to rule out any underlying conditions," the patient needs to understand that they're trying to eliminate certain possibilities in order to narrow down the diagnosis.
That's right. And another phrase that can be really helpful is to be on the same page. This means that everyone involved in the patient's care is in agreement and has the same understanding of the situation. It's especially important in healthcare, where communication can be a matter of life and death.
I remember when my grandmother was in the hospital, her doctors and nurses would always make sure to touch base with each other and with us, her family, to make sure everyone was on the same page. It was really reassuring to know that they were all working together to get her back on track.
That's wonderful. Touching base is a great phrase that means to check in or communicate with someone, usually to make sure everything is okay or to coordinate plans. And getting someone back on track means to help them recover or return to a normal or healthy state.
Let's do a role play to practice using some of these phrases in context. I'll be the doctor, and you can be the patient. We'll go through a mock consultation and see how many medical idioms and phrasal verbs we can use.
Sounds like fun. I'll start by saying, "Hi, doctor. I've been feeling really under the weather lately, and I'm hoping we can get to the bottom of what's causing it."
Okay, let's take a look. Can you tell me more about your symptoms? We'll need to rule out a few possibilities before we can narrow down the diagnosis.
Well, I've been experiencing a lot of fatigue and joint pain. I'm worried that it might be something serious, but I'm hoping it's just something we can treat and get me back on track.
I understand your concerns. Let's run some tests and see what we can find out. In the meantime, I want you to keep a journal of your symptoms and any factors that might be contributing to them. This will help us piece together the puzzle and find a solution.
That sounds like a great plan. I'll make sure to touch base with you regularly and keep you updated on my progress. And if I have any questions or concerns, I won't hesitate to reach out.
That's exactly what I want to hear. We'll work together to get you the care you need, and I'm confident that we can find a way to manage your symptoms and improve your quality of life.
Thanks, doctor. Just talking to you has made me feel a lot better. I think we're really on the same page now, and I'm looking forward to working with you to find a solution.
Me too, Emma. Let's schedule a follow-up appointment for next week and see how you're doing. In the meantime, don't hesitate to reach out if you have any questions or concerns.
Will do, doctor. Thanks again for your time and expertise. I feel like I can finally start to turn the corner and get my health back on track.
You're welcome, Emma. I'm always here to help. And remember, turning the corner means to start to recover or improve, so let's keep working together to make that happen.
I will, doctor, and I think that's a great place to leave our role play for now. Let's take a break and come back to this conversation in our next segment.
Sounds good to me, Emma. We've covered a lot of ground so far, but there's still more to explore in the world of medical English. Let's keep the conversation going and see where it takes us.
Now that we've explored various medical idioms and expressions, I think it's essential to share some final tips on how to use them effectively in conversations. Liam, what are your thoughts on this?
I completely agree with you, Emma. One thing that I've found helpful is to practice using these idioms in context. For example, instead of just memorizing the phrase "to be on the mend," try using it in a sentence like "after a few days of rest, I'm finally on the mend and feeling much better."
That's a great point, Liam. Another idiom that I think is useful to know is to take it easy. This means to avoid exerting oneself or to relax and not do too much. For instance, the doctor told me to take it easy for the next few days and avoid any strenuous activities.
Exactly, and I think it's also important to understand the nuances of different idioms. For example, to be under the weather is a common phrase that means to feel unwell or sick. But to weather the storm is a different idiom that means to endure a difficult or challenging situation.
That's a great example, Liam. Now, let's talk about the phrasal verb to rule out. This means to eliminate or exclude something as a possibility. For example, the doctor was able to rule out any serious conditions and diagnosed me with a minor virus.
I see what you mean. Another phrasal verb that I think is useful to know is to look into. This means to investigate or research something. For instance, I'm going to look into different treatment options and see what's best for me.
That's a great one, Liam. And finally, let's talk about the idiom to be in good hands. This means to be in a safe or capable situation, often in reference to medical care. For example, I know I'm in good hands with my doctor. She's very experienced and knowledgeable.
I love that one, Emma. It's such a reassuring phrase to hear when you're not feeling well. Okay, so let's recap some of the key takeaways from our conversation today. We've covered a range of medical idioms and expressions, from to have a clean bill of health to be on the road to recovery.
That's right, Liam. And I think it's also important to remember that practice makes perfect. The more you practice using these idioms and expressions in context, the more natural they'll become. So, don't be afraid to try out new phrases and see how they work in different conversations.
Absolutely, Emma. And I think that's a great note to end on. We've had a really informative and helpful conversation today, and I hope our listeners have learned something new and useful.
Me too, Liam. Well, it looks like we've covered everything we wanted to discuss today. I think it's time to wrap things up and say goodbye to our listeners.
Before we go, I just want to thank our listeners for tuning in to this episode of English Vibes Hub. If you liked this conversation, be sure to like and subscribe to our channel for more content like this, and we'll catch you in the next one on English Vibes Hub.